Hello, I'm Ollie Lewington. I work for the Cystic Fibrosis Trust, and today we're talking about the increasing personalisation of healthcare in cystic fibrosis. And I'm joined by three people who are going to share their personal experiences of cystic fibrosis. So, do you want to introduce yourself, guys? We'll start with Kira.
Hi, my name is Kira Hillier. I'm 23 years old and I live in Bristol. I was diagnosed with cystic fibrosis at a week old. I very much enjoy photography, making videos for YouTube, pennyboarding, and taking lots and lots of photos of my dogs, apparently.
Great. Thank you, Kira. Liam.
Hi, Ollie. My name's Liam McHugh, and I'm from a little town called Castleberg in County Tyrone in Northern Ireland. I have a 24-year-old daughter called Rachel with cystic fibrosis, and she was diagnosed at 6 weeks old and keeps quite well, thank goodness. And hobbies for me is running marathons for CF, mainly. I run 6 days a week, minimum, sometimes 7. Sometimes I have to take a rest, but various fundraising events for cystic fibrosis. And this Friday night, for the first time, I'm doing a new thing. We're having a concert for CF, and I'm going to get up and sing. And to me, I'd rather run a marathon, but I'm going to give it a go anyway. And I just love fundraising for CF to try and get that life unlimited for everyone with CF. That's me.
That's incredible. I think you're absolutely bonkers. Sammy, would you like to introduce yourself?
Hi, I'm Sammy Reid. I'm 36 and I live in Suffolk. I'm married and I have a son who's 15. I was really well through my pregnancy, luckily, but last year I had to stop work due to the fact that I was having too many admissions for IVs and things had to change. So it came down to pretty much, quality of life rather than, working. So I'm now a lady of leisure, but I sew a lot and I cook and I do exercise a lot. That's the one thing I found that has definitely helped keep me well. So that's me.
And Sammy, you've been involved in a remote monitoring study recently. Can you talk a little bit about how that's allowed you to understand more about your health and about your day-to-day habits?
Yeah, of course I can. So I trial, and as part of that, you had to take your lung function. You had to do your weight, your pulsometer, so your oxygen levels. You had to do a sputum sample. You had to to monitor your coughing, your sleep patterns, and your quality of life, whether you felt well. And from that, you could pretty much trace how you were doing in your day-to-day routine. And then from that was synced to an app on a phone. And the phone then synced back to the hospital. The hospital then could look at your results. And from that, they could see if, the idea of it is to stop you needing as many clinical appointments. That's the main thing. At the moment, it's only at trial stage, but for me, if that came into force, it would definitely help, and it's definitely kept me well. Whether that's coincidence, I don't know, but I can look at that and think, I'm losing weight, I need to eat more. My lung function's gone down a bit, I need to obviously exercise a bit more, but not too much that I obviously still need to rest. But, it definitely has helped.
And Liam, from your point of view as a parent, when Rachel was younger, do you think that having some sort of remote monitoring, some sort of ability to keep a check on things that Sammy was just talking about would have been useful to you as a parent?
Oh yeah, most definitely. Looking back over the years, say at Rachel, a few years, it's only the last few years I've seen maybe real good progress in research and trials in cystic fibrosis and stuff like that. And I suppose 24 years ago for me, when Rachel was born, we were told maybe in the hospital that there was brighter things ahead in the future and there's things to look forward. And Creon was just introduced at that time when she was born. Then DNAs and stuff like that came along, but there was nothing really in development of stuff like what Sammy's talking about. And I suppose that's the progress that's been made over the years. But without doubt, I think that would have been a really good help to be able to monitor lung functions and to be able to see what the weight was and if you needed, certain things at certain times and exercise and all that. And I think that's really good. And gosh, I didn't even know of trials like that. So as well, I think definitely in the younger years for Rachel, that would have been so important. And as I say, maybe it's only becoming available.
And talking about research, Kira, you went up to Newcastle recently to meet Professor James Shaw, who's leading our Strategic Research Centre on CF-related diabetes. And obviously, you've been quite open about the fact that you have CF-related diabetes, and I'm interested in what it was like for you going to see a research project that could potentially have direct impact on you and your life.
Yeah, that was a very, very interesting day. I wasn't sure what to expect just because when I think of diabetes, I don't necessarily think of the science of things. I normally think about how I just manage diabetes in my everyday life. And what was great to see was the crossover between regular diabetes and then cystic fibrosis related diabetes. Just because sometimes it's quite hard to explain the differences between the two. But when I was talking to Professor James Shaw, I was able to see his enthusiasm for the whole project, and I was able to understand a little bit more about diabetes and how possibly when we do think of diabetes now, it's diabetes as a whole. It isn't just type 1 and type 2, and then CF is this separate side of things. With cystic fibrosis, I think a lot of people tend to think about the lungs, but there's so much more going on that people won't necessarily know, that now that we can now recognize CF diabetes with diabetes in general, I think it's a great way forward.
Sammy, when you look at the kind of research that's being done at the moment, is there anything that you think from your experience of CF, is there anything that you're keen to see more research into, or you're keen to learn more about the research that's currently happening?
Yeah, well, I suffer quite badly with reflux, and I find that when my reflux is really bad, I definitely struggle more. I suffer with my CF-related asthma, so I find that my airways get really, really tight. So I now take steroids continuously to keep my airways open. Find that that's the one thing that I do tend to sort of suffer more with than anything else. So for me, if they could do some more research into the acid side of things, I think that would, for me, I would definitely be there. So.
And Liam, from your point of view, is there anything that you think is pertinent to the CF world at the moment that you'd like to see more research into?
Well, for me, personally speaking, Ollie, what I would like to see is, I suppose, maybe not in a selfish sort of a way, but I would like to see more stuff that's going to be beneficial to the likes of my daughter, Rachel, and Sammy and Kira, the older CFers, because for me, I think children born with CF today are going to have possibly that CF life unlimited, a cure. So what I would like to see personally would be not long-time strategies in CF research, but more an impact on people living with CF today, short-term strategies. And I don't know if that sounds selfish or not, but we've, all of us here today, not me, but my daughter and the other two girls, have grown up with CF all their lives, and it would be just nice to see something, maybe I'm being selfish, but I want to see a cure now, and that's it, short and sweet.
And so, talking about clinical trials, and we've talked about the importance of research in general, but also how trials help us moving forward with the various new advances that are coming about in cystic fibrosis. And Liam, Rachel was on the trial for Orkambi, and I'm just wondering if you can talk to us a little bit about what the actual experience of being on a trial is like.
Well, Rachel went on Orkambi, the trials, roughly around 3 years ago. And I suppose when she was asked about taking part in the trials, we were sort of a bit anxious and a bit nervous about it because of, side effects and different things like that. But at that time, Professor Stuart Elborn was Rachel's consultant, and he said to Rachel, he said, "Listen, Rachel, I think that these trials would be ideal for you." And to be honest, he's a wonderful man, and he's done so much for CF and research, and we were quite happy, to go with it. And Rachel, of course, it was her decision, being an adult, but as a parent as well, being anxious as well. But we were both, my wife Eleanor and myself and Rachel and all, were more than happy for Rachel to take part. And I have to say, Orkambi for Rachel has just completely changed her life. It's the only way I can describe Orkambi is I call it a wonder drug, and it's been hard work. The problem is where we live in Northern Ireland is right up at the very top tip of Ireland, near the coastline in Donegal, and Belfast is where if Rachel takes a cough or a cold or a sneeze or anything, we've got to drive to Belfast, and that's 2 hours drive. So sometimes if you ring the hospital with a cold or a flu, or there's a wasp at me there. If you ring the hospital, they think that you're in the outskirts of Belfast and say, "Oh, bring her over. You'll be there in 10 minutes." But anyway, that's beside the point. But when we started the trials, we were driving Rachel up to Belfast every 2 weeks at the start, regularly every 2 weeks, and then it went to every month. But at the same time, we would have driven to Ciara's family's place down in Cork. We're just talking there. It's about 7 hours drive from where we are down to the bottom of Ireland. It wouldn't matter what distance it was because of these trials. But I say, Orkambi for Rachel, in the end up, it just didn't happen overnight. But Rachel's lung functions rose by 19%, which is massive. And weight gain and stuff, Rachel was always on the borderline of her weight. She'd never been taking any of those supplements and stuff like that. She didn't like them, but she always kept just at around the right weight. But she put on nearly a stone in weight with her Orkambi. So the lung functions, the weight, things like energy. The energy she has now is remarkable. She has so much energy. She can get up first thing in the morning, full of beans, after being out maybe late that night and stuff like that. And coughs and colds, stuff like that. Say I've had in the last 3 years, maybe say 15, 20 coughs or colds. Rachel's had about 2. It's unbelievable the way, and we're always running about the house, different towels and being careful with hygiene and all that, and still do, but for me, less admissions to hospital and stuff because of the less coughs and colds and stuff, And then we went through a period, there was a bit of a mix-up with Rachel's drugs, the Orkambi, and she was 3 weeks without Orkambi. She'd done her lung functions up at the hospital when we were told to go back up for Orkambi, and her lung functions had dropped by 16% in those 3 weeks. So we were back up a month later, and they were back up again, that 19% or 16% again. So for me, Orkambi is a life changer, and I cannot describe how much it's changed our lives as well as Rachel's life. And Rachel's had a degree in psychology. She's got a first-class master's with distinction, and she's currently doing a PhD. And she said herself she wouldn't have been able to do what she's been doing this past 3 years if it wasn't for Orkambi. So that's why I call it a wonder drug. She ran a 5K race there just a couple of months ago and beat her mother. So, it's changed her life.
It sounds incredible. And Kira, we heard Liam there saying that they would have been part of a trial. They would have driven the length of Ireland to be part of a trial. Would you agree with that? Would you be interested in being part of a clinical trial?
I think when I was younger, my mum and my dad, they were kind of hesitant to put me forward for any trials just because, again, the side effects, you never know what's going to happen. But now I'm at the age now where I make all my own decisions. And I think if there was a trial that I was able to be a part of and other people, perhaps the younger generation, would benefit from, I think I probably would really, really consider it, depending on what type of trial it was. Luckily, at the moment, my health is pretty good. I've kind of found my own miracle drug, which is the Cystic nebulizer, and that's given me a whole new lease of life. I have so much energy, and I have a lot of motivation to do things at the moment, because I think when you're unwell, you lose so much motivation. It's incredibly tough. But again, kind of coming back to what Liam was saying, for the older generation with cystic fibrosis, it's very difficult just because we weren't given the options that perhaps the younger ones are given now with all the advances in medication. So if I was able to help in somehow for the future of CF, then I would definitely consider being part of a trial. Absolutely.
And Sammy, would you agree with that?
Yeah, the only time that I wouldn't was I did try one medication that obviously didn't agree with me and made me go very, very tight. So I removed myself from the trial. But at the end of the day, anything that you've got a benefit of helping you. One particular trial I did do was for a nebulized algae product. One was a placebo, one was the main thing. I knew which one was the main thing. You could just tell it made such a difference. But that kept me out of hospital for 10 months. So I can't, different things, at different times do definitely work, but it's just getting that license for them, isn't it? And, they've got to be trialled before they can, go to sort of pharmaceutical, outlets. So, I think it's just a waiting game, really, isn't it, for, new advances and new treatments. But definitely you need the patients to trial them to know that they work.
And would it make a difference to you if you had to stop a particular treatment? So, for example, if you were on Orkambi, if you were told that to be part of a new trial you'd had to stop Orkambi, would that make a difference to whether or not you considered being part of it?
I've never. I don't know what Orkambi is, to be fair. I haven't heard of that as a drug, and I was going to actually ask whether it was a nebulized medication or a tablet, or how it was actually administered. If it was working for me, and it was a case of having to come off of it, probably not, because if things are going good, why change it? Why rock the boat? That's what, in my heart of hearts, that's how I'd feel. But if it was a case that you weren't particularly seeing any positivities, then yes, I would change.
And how about you, Kira? If you've found this nebulizer that works really well for you, if you were told that you had to stop that to be on a trial for a new drug, would that make you reconsider being part of a trial?
If I'm honest, I think I probably would reconsider, just because at the moment with the nebulizer that I'm on, they want you to have it for a month on and then a month off, and during that month off, I can feel the difference. I get really unwell. I get very, very chesty, and my sinuses get very full up, and I do feel a difference. If I could stay this well without the Cystic, then I would be up for anything. But it's taken a very long time to find this one drug that really suits me, just because I'm allergic to so many different antibiotics. Being able to have this one that is literally, it makes me feel so good. If I had to give that up, it'd be a very, very hard decision. If the Cystic became unavailable to me, just like I know that there's lots of problems going on at the moment with Orkambi, I can't imagine how that would feel, having that one thing that makes you feel good taken away from you. It's pretty heartbreaking, if I'm honest. I wouldn't like it at all.
So I'm going to wrap this up now because we've been chatting for a while, but thank you all so much for being part of this discussion. The last thing that I want to ask you is just in terms of the personalisation of cystic fibrosis treatment, how you feel about being treated in a much more individualised manner, being treated as an individual as opposed to just another person with cystic fibrosis, and what your experience of that has been. And Liam, from your point of view, has Rachel seen benefit from being treated as an individual rather than being treated as another person with cystic fibrosis?
Well, I suppose, Ollie, for me, I suppose it's not up for me to sort of speak as Rachel herself, but in my reckoning, I would say, yeah, personalised medication, I suppose, for Rachel would be mostly more important for her, because being treated as an individual is what way it affects her. So at least you could be looked at of what way her condition is and what way, instead of, say, Orkambi might work for Rachel and maybe it might not work for somebody else, stuff like that. So being treated as an individual, I think, is very important, because then you can look at that one individual person and say, let your doctor or whatever prescribe what is most suitable for her. So, for me, as I say, I'm not Rachel, but that's only my point of view. I think the other two girls might be more suitable maybe for this question. Passing the buck.
So, Sammy, from your point of view, particularly with the remote monitoring that you've been doing, that obviously tailors what you do much more to you as an individual. And have you found that beneficial?
Yeah, definitely. The thing is that because of you've got that one-on-one with the hospital, you are an individual anyway, because you've got that relationship where they can look at your statistics, what you should be, how you're performing, and then from that be able to actually, and also from your samples, for example, if anything's growing, they've got that, and it just saves that you've still got the closeness, but not having to do that trip like Liam was saying. You drive as far as you had to for the care, but to be able to lead that slightly more normal life without having to go every 6 weeks, it's got to be a benefit. It really has.
And so, Kira, from your point of view, when you're looking at additional complications like CF-related diabetes, does individualised care make a big difference to you?
Well, I think cystic fibrosis as a whole is a very personal thing, because cystic fibrosis affects everybody so differently. And with the staff at the hospital as well, it's not just someone that you see one week and then there's someone different the next week. You grow up with these people, so they get to know you. And I think everybody gets treated kind of individually, and every kind of different medication is what's the word I'm looking for? I can't think of the word, but everyone will have a different kind of cocktail of drugs. And with the diabetes, I'm kind of looking forward to in terms of the research is it won't just affect me, who does suffer from CF-related diabetes, but hopefully the research will contribute to other people with diabetes. So in that way, it will affect everybody as a whole. But if we can manage one part of cystic fibrosis, it makes everything kind of a lot easier to handle. Not, CF is never going to be easy, but if we can kind of fix certain little things, eventually the bigger picture is just a lot better.
Thank you all so much for being part of this. It's been a really fascinating discussion, and I really appreciate your time. I'm going to let you go, but thank you very much.
All very kind of bizarre, very overwhelming. But I think for me it was just a natural progression of that's what I've been aiming towards for 10 years. So